you want me?
Okay, perfect. Let's go. Where are we? Ah. Hey.
So I just request permission.
Okay. Can't see you yet. Hola Ana, ¿qué tal? A ver, ahora espera. Okay. You should come, you should arrive soon. Hello. Hey guys, we are trying to record this also on Zoom. So can you hear a lot of like noise or reverberance? Is it okay? Can everyone hear? Can you talk a little bit, Abby?
Yeah, I can talk. I hear a little, I think there's going to be an echo.
Yeah. Let me see. Okay. Okay. Let's see if, can you talk again?
Yeah. Can you hear me?
And then what I've done is completely stop my microphone on Zoom.
Okay. Can you hear me better now?
Yeah, I don't hear any reverberance. Can anyone hear anything? Everything is fine?
Sounds like it's okay now.
Okay. Okay. Welcome. Welcome to this live Instagram with amazing and superwoman Abby. So she is just like spending all her life doing research for EDS in animals and in humans, which is really amazing. So obviously, you know that you can all ask questions. That's why we are here. But I'm going to start just asking some questions and a little bit of conversation. So, okay, let me just remove completely the sound. So then you know what we're going to be talking about. Okay, so Abby, do you want to just tell us what is EDS and why that cute cat of yours and the rabbit has this crazy skin?
Sure. So Ehlers-Danlos syndromes are a heterogeneous group of connective tissue disorders. So basically, when you have EDS, you've inherited a genetic mutation that either affects a collagen gene itself or a gene involved in collagen processing. So it can be a protein associated with collagen or like a collagen chaperone protein that oversees the folding of collagen that's affected. So what you're left with is a disorder that causes loose, stretchy skin, hypermobile joints, vascular and visceral fragility. So those are the big things that we think about. So, you know, I can still hear an echo. I don't know if
you have you completely stopped your sound?
No. Okay.
Yeah, completely stop it. And can you talk a little bit louder?
Yeah, let me get a little bit closer to the mic here. So in the old days with EDS, what we would think about is if you've seen like the old freak show pictures of people stretching their skin really far, but that's really a very narrow view of the disorder. What we know now is that, you know, your connective tissue is everywhere in your body. It's the most abundant protein that you have is your collagen. So really EDS affects everything. It affects your GI, it affects your urinary tract, it affects your brain. So what we're learning is that really you have trouble with every body system when you have EDS. So really the big complaints that we see from people in terms of what causes a lot of disability are things like dysautonomia, mast cell activation syndrome, gastroparesis, and those are things that in the old days people didn't really realize were associated with EDS.
Yeah, and the reason why, first of all, like Abby is so amazing about her research is that she does have EDS herself. Mm-hmm. Her cat has EDS. And one of the reason why I personally was very interested is because of the neurological consequences. So The big one in human, well, I don't know if it's a big one. You're going to tell us how frequent it is Chiari malformation. Mm-hmm. And then the theory of the problems with the Tether Core, which is what we published the paper recently. So we're going to try to talk a little bit about that. And then we're going to try to explain you a little bit our thoughts and kind of these cases that could be a little bit more tricky. So in case you have seen cases that they are similar or you would like to ask any questions about. So how frequent is in EDS people to have Kyary?
So we don't know the number in terms of how many people with EDS have Kyary, but when there was a large group of Kyary patients looked at, 12.7% of them had EDS. Yeah. So it's pretty frequent.
So remember, guys, that what happened with Kyary is that at least there is a lot of type of Kyary in humans, but in our dogs, we have what we call an overcrowded caudal fossa. So the cerebellum doesn't have enough space. And then we have a CSF disorder. So the CSF cannot go through the foramen magnum correctly. And then we have this accumulation of the spinal fluid, the syringohydromyelia within the spinal cord. There is a lot of theories of why that happened. Why is that cerebellum trying to get out? And there is theories about that the Cavalier King Charles may have a caudal fossa that is a little bit small. But there is also other theories that are called the traction theory. So can you tell us what is the traction theory?
Yeah, so what people started noticing was that a lot of patients had both Chiari or just low-lying cerebellar tonsils and tethered cord syndrome. And what the theory was is that if you're tethered, the tethering of the phylum terminale could be transmitting tension all the way up to the level of the cerebellum and literally pulling the cerebellum down and causing a Chiari malformation. When people then went and did cadaver studies, that was really hard to prove because, your spinal cord is somewhat protected up the length of the spine by the denticulate ligaments. That said, in someone with a connective tissue disorder like EDS, if those ligaments are abnormal by virtue of their connective tissue disorder, it may be that the whole system is bad. And so something like a tethered cord could really set you up for failure in terms of Chiari.
So what is Tether Core? What is this concept of the Tether Core that we're talking about? So can you tell us about what is the phylum terminale and what we said about the Tether Core?
So your spinal cord ends at the level of the conus medullaris, but then there's this collagenous band that comes off the conus that's called the phylum terminale. So when you're an embryo, the phylum is spinal cord, but as the embryo is developing, the spinal cord dies off at the caudal end and becomes the phylum. So there's a part of the phylum called the phylum terminale internum that's intradural, and then there's an extradural part that's called the phylum terminale externum. So what the phylum is theorized to do is to stabilize the spinal cord at the level of the conus when you're flexing and extending your spine. And then above the level of the conus, you have those denticulate ligaments that are helping with stabilization. So in tethered cord, there's a lot of different forms of it. So historically, people thought of it as kind of the forms that occur with spina bifida, but we now know that there are other forms that occur either when the phylum is just mechanically stretched by virtue of either just inelastic tissue being present within the phylum, or
just remember that these are like the cases that we used to see as veterinarians are all these, especially the English bulldog without the tail, with all that meningomyelocele, the spina bifida, all these dogs that they are incontinent, they are fecal and urinary incontinence, and they don't have a tail, and also the Manx cat. But the trick is that it can not only happen on these animals that have these horrible malformations, right?
Yeah, and so in EDS patients, we don't really see it with the true spina bifida. Sometimes we see it with spina bifida occulta, but what we're seeing is that the phylum grossly appears normal on MRI, but for some reason, people are still presenting with what we call occult tethered cord syndrome. So they have these symptoms, and what's likely happening is that the phylum has some degree of inelastic tissue within it. So it can't do that job of stabilizing the spinal cord. So it allows the cord to be stretched, and people present with symptoms that go along with having a gray matter lesion within the spinal cord.
And that's where we really we were like so passionate about publishing this case, because I'm sure that you all have cases, and I would love if some of you could actually share these cases, because I'm sure that we can chat about them and we can tell you if we think that it could be one of these cases. These are cases that could be at any age, but a little bit more frequent, that is going to be maybe a young dog that it has an incontinence and you don't know why. It just has most of the times I would say that in dogs probably it could be a combination of having maybe chronic UTIs because they cannot empty the bladder completely, and then you have probably a dog that is kind of maybe having like strong urea or also having a pollakiuria, and you cannot find any neurological signs. You have done everything, you have done a cystotomy, you have like checked the bladder, you've done everything, and you don't know why they have that in urinary incontinence. And it's true that in the past, we will always have our internal medicine coming to neurology and say, oh, this must be new. You're like, no, I don't see anything on the MRI. But actually, you don't see anything on the MRI, but it's not because you don't see anything on the MRI that incontinence is not neurological. And this is what it's about. These cases that you cannot find why the hell this animal has a urinary incontinence. And most of the times we need to be careful. There is not only the urinary incontinence. In humans, they have other little signs, don't they?
Yeah, so we typically look for kind of a constellation of clinical signs. So neurologic signs tend to vary by age. So in young kids, we look for hyporeflexia, in-towing, things like that. In older people, it tends to sort of skew more towards hyperreflexia. They also can present with orthopedic signs, so scoliosis, kyphosis, things like that. And then they can have GI signs, so like chronic constipation, fecal incontinence, things like that can occur. It's a little bit less common, but the urologic signs tend to be the more consistent, and I think probably more of what we would see in animals.
Yeah, definitely. And that's what this case was about. We had this Italian Spinoni that was already seen by internal medicine because we saw him first at 5 months old. He already had a few months of like repeated and chronic UTIs. Internal medicine did all the tests. We also did the MRI and we couldn't find anything. And the dog had, actually, you could see the video on the paper, the read.
Yeah.
So that's a cat with EDS. Can you show them the skin? You see, guys?
Itchy skin, kind of the tragic facial expression is common.
Yeah. So the EDS actually in animals, we can talk a little bit about how common it is in dogs, but I have the feeling that we do see it quite a bit in cats and
cats more. Yeah. Yeah, there's not really any statistics behind it, but it does seem to be a little bit more common in cats than dogs.
Yeah, and what you will see in these EDS animals, guys, is going to be that skin fragility. And you saw on the video that we posted that these wounds, that they are super extensive, but they don't bleed that much.
Yeah.
Almost look like it's like old wound, right? That has been there like without closing, but then they close very, very good, right? Once you stitch him up, he heals really quick.
Yeah, they heal fine. People tend to be really nervous about taking them to surgery for anything, but they tend to do fine. They heal great. I've never had any problems with them. I did my master's on HERDA in quarter horses, which is Ehlers-Danlos in quarter horses. And I mean, things like castration and all those more minor surgeries, they do fine. I don't really notice a difference from a normal animal with them.
And what are the other things that the EDS patient, because we are just talking a little bit, it's a little bit more obscure, these like Tether Core and the neurological signs, but what will be the most common signs that like the vets will see?
I mean, definitely the skin issues are the most common in the animal population, especially with the cats. That's where you can really get into the catastrophic wounds. Orthopedic, in cats, the joint hypermobility tends to be a little bit less common, but we definitely see it occasionally and see it a little bit more in dogs. Those are the two big things. Occasionally we'll see things like aneurysms. I know of 2 cases of fatal aneurysms in animals. So it can occur. Also ocular issues, so retinal detachments, ruptures of the globe, things like that can happen.
Yeah. And what we've been a little bit, because we are trying to dig a little bit into these cases of putting together these EDS, Chiari Malformation, and Tether Core, and something that I've started to obviously pay more attention, but the problem again, these cases are difficult because they are usually young patients and the owners, they may not be that motivated to go ahead with investigate. But for example, the last case that I had was also a very young Mastiff that came to me because of chronic UTIs and incontinence. And this dog already had, I think that it was 1 year old, and already had both cruciate fracture, which definitely that could be also a sign of EDS in dogs. And that's why we are a little bit digging into the Cavalier King Charles.
Yeah, and it's interesting. I mean, there was also a paper that showed that dogs with patellar luxation have some degree of collagen abnormalities elsewhere in their body. They did some electron microscopy on them. So, you know, it is a spectrum. There's a form of EDS in humans called hypermobile EDS. That's the most common form that we don't know the genetic basis for yet. So it's possible that there are forms like that that are a little bit more mild in terms of the skin signs that occur in animals that we're just not picking up on yet because we don't have a great diagnostic test for them.
So I ask you guys there, have you, any of you can think about a case that you had like a young, it's true that we haven't seen yet any cats with suspected Tether Core, huh?
Well, no, other than Reed.
Yeah, well, but he's not incontinent.
A little bit.
Oh, is he?
Yeah.
Oh, we need to check that then. So how many of you can think of a case that you had a young dog that maybe had some kind of ortho problems, like whether luxating patella, a cruciate, or maybe some LS pain, and have like this incontinence that you never find about? Can you think, guys, about cases that you have had? Because we really want to see how much, because we have the feeling that we are missing quite a lot of these cases, and again, like particularly because we find that there is a chronic UTI. So I guess that a lot of these cases maybe they are dismissed by, yeah, there's a chronic UTI and that's why you're incontinent, when actually you have a UTI because you are incontinent and you cannot empty the bladder completely. Okay, let's see if someone can share some of the cases and we can publish more. So what we did on this dog then, we could not find any abnormalities on the MRI and no abnormalities on the all the tests for the bladder. We did a uroscopy, we did a biopsy and everything. So we did what actually you had done because you had that surgery done. Yeah. So tell us about the surgery that you had. And why did you have that surgery?
I had surgery for Tethered Cord in 2015. I had it mostly due to chronic progressive kyphosis and severe back pain and some weakness in my legs and loss of sensation in my feet.
Because you have Kyary also.
Oh, I have Kyary also, yeah. I have a lot of things to deal with. So yeah, I had it. They transected my filum terminale internum. You know, it's a very painful surgery in terms of the first few days post-op. It's definitely you're flat 24 hours to prevent CSF leaks, and then in the ICU a couple days. But I did it the middle of my 3rd year of vet school and didn't take any time off, and the recovery after the first week was pretty easy.
And what was the improvement that you had after the surgery?
My back pain definitely got better. The kyphosis got a lot better. I was able to straighten my back. My legs got a lot stronger. I was hiking in Iceland 3 months after surgery. So I think I was a lot stronger afterwards.
I know she is. I know that someone is saying that you're very strong. I know that she is super strong and she's superwoman. And actually something that I want to share about Abby that I think that is also very important for a lot of people. Like, She wanted to do a neurology residency, but she realized that she physically would be a little bit too much for her, but that has not stopped her continue with the research, and she's just like doing amazing. She has been doing a lot of research with horses and now with humans, and she's definitely doing the One Health idea of trying to get everything on the same level, as she has spent a crazy amount of money to pay a company to get all the DNA of a rabbit that they had with EDS, and she's very crazy.
Well, yeah, that was in my colleague Lyle Cleary and I split the cost of having a rabbit with EDS's genome sequence. So he's actually watching right now, but if anyone's at Exotics Con, they can come and see us present on that, and hopefully our paper on that will be out in the next year. So that would be very exciting.
That would be really good. So, so then going back to our Tether Core and our Kyary. So what we did on this dog that he did not have, he did not have Kyary.
Right.
And so we did detether the phylum, but we did detether the phylum externum, and the dog incontinence got much better, and especially the back pain and the weakness that he had improved dramatically.
Yeah.
But yeah, we have only done this surgery once. We have done this surgery twice. It was this patient, and then we did it also on a dog with a Chiari Malformation, which that is probably the other big thing that we would like to a little bit develop, will be following that idea that in humans is done regularly. But then the interesting thing, there's some people that they believe in the traction theory and people that they don't believe in the traction theory.
Yeah.
But the neurosurgeon that you work with obviously believes in the traction theory, and she is doing the detethering before doing the COM surgery, because you haven't had the COM surgery, have you? You only have had the detethering.
No, I haven't. And most surgeons do the detethering before the Kyary surgery. And a lot of patients at least have some improvement of their Kyary signs after they're detethered, in terms of at least some improvement in headaches and things like that. So I think there's something to it, whether it's true traction all the way to the cerebellum, or whether there's something else going on in terms of CSF pulsations within the cord that are disrupted by tethering. There are a lot of other factors like syrinx formation that's thrown in the mix of all of these things. So, you know, I think it's a complicated scenario, but I think detethering the phylum at least seems to be doing something to help with symptom improvement.
Also remember, guys, that we do have a lot of dogs with Chiari Malformation, and you know that the typical treatment that we do for these dogs will be a medical treatment, which will be pain relief, for example, gabapentin, amantadine, sometimes tramadol, which I personally don't like that much. And sometimes we need to use once in a while a little bit of steroids because they can be very painful. When the medical treatment is not working anymore, that's when we decide that we may want to do surgery. And the surgery that has been described in veterinary medicine is the caudal occipital craniectomy. So basically what you do is you remove part of the occiput and part of C1, and you open the dura, let a little bit of room to the cerebellum, and then you put some Duragen, and then you put a titanium plate over that area. I've already posted this before. But we know that in veterinary medicine, this surgery is not always successful, in terms that after a few months or few years, dogs may be painful again. And in humans, there is also a lot of complications with the surgery, particularly if you have EDS. Because if you have EDS, you're creating more instability around that area. And it can be very, very problematic. And a lot of people, they need to have more than one surgery after having COM surgery, right?
Yeah, and a lot of people end up with the Kyary surgery and then also a fusion, because the complicating factor, in addition to tethered cord and EDS, is that a lot of people have severe cervical instability. So they end up needing multiple surgeries for that. And it's not usually a one surgery fix situation.
No, which does a little bit the problem with veterinary medicine, that usually we just have one goal to do one surgery. and then hope that with one surgery that you've done is going to fix all the problems. So what we want to do, and you guys need to send us cases, girl power, we have already done one case, and hopefully we can publish it soon. We have done a detethering of a dog with Chiari malformation, and it was really successful, and the dog is completely free of all medication, and he's doing really well. So kind of wanted to see a little bit if this, what they are doing in humans right now, which is doing the detethering first, which has definitely much less complications. What are the typical complications in human medicine when you're doing the detethering? So let's compare like comb surgery versus detethering.
There tend to be very few complications. Occasionally someone will get a CSF leak. Occasionally there can be some breakdown at the incision site, but other than that, I mean, they're pretty few and far between. I mean, infection very rarely, but it's a pretty safe surgery.
Yeah, you will be, because you don't put any implants, what you are doing, what they are doing, they do like a micro, like endoscopic, actually, yeah, endoscopic approach, like tiny laminectomy to
inner laminectomy between the two vertebrae. So you're taking as little bone off as possible. And then what we tend to do in the EDS patients is use a fat graft. So the patient's own fat is harvested and then put over the dura to try to create a seal to prevent a CSF leak. So the complication rate, at least where I work at Rhode Island Hospital, is very, very low.
Yeah, and it will be the same for dogs. Like also you are going to be doing a dorsal laminectomy without touching, mini hemilaminectomy without touching any articular process. So you're just going to touch in one compartment. You're not going to create any instability. And that compared to the comb surgery, which obviously in humans, it has a little higher rate of problems. In veterinary medicine, we don't have a lot of rates of problems after the surgery, but the problem is that the surgery doesn't work long term, unfortunately. What we haven't done, so what we did is we did the tethering on a dog that already had comb surgery. And although he improved after the surgery, then he was painful again. So we had quite a lot of MRIs following everything up. And then the dog, after the detethering surgery, has been free of medication. Yeah. What we want to do now will be nice to be able to do a detethering before a comb surgery. That would be really, really interesting.
With the detethering, one thing that can happen is you can retether. I think that was a little bit more common in the old days when they would just literally make a single cut through the phylum and not actually remove any of it. So there was a lot more tissue left to sort of stick to surrounding structures. Now it's more common to remove a large piece of the phylum. But it certainly can still happen, especially with the fatty phylum. So when the phylum is full of adipose tissue, it tends to want to stick to surrounding structures more. And then arachnoiditis, which sort of goes along with that and can be a contributing factor to the retethering. It can happen, but it's pretty uncommon.
Yeah. And one thing, for example, that is interesting, the difference between humans and our dogs is that humans, they are also all the time very, very cautious and careful about not having CSF leak, that you've been saying it a few times. And CSF leak, it is a very big common cause of pain, right? Of migraines and...
Yeah, and I mean, in EDS patients, it's something we worry about all the time because the dura is so much more fragile in an EDS patient than a healthy person. EDS patients often present with spontaneous CSF leaks, regardless of whether they've had surgery or not. So it's something that we tend to be a little bit more on top of in them.
Yeah, and which actually, that's the interesting. I've already seen a Kyary surgery in humans, and they spend so much time on closing the dura. By the way, there is an amazing product called DuraSeal that you just gel that you put over the dura to completely make sure that you don't have any leak. And what we do in dogs is not that. It's completely not the opposite, but we open the dura. Actually, we're going to marsupialize the dura so it doesn't close, and we just put Duragen over the cerebellum. Don't ask me why there is a difference. I will say because of the supine versus quadruped position. And I'm also very interested how also, for example, all these links to our Arachnoid Diverticula. because that is another very interesting subject. Remember, guys, all these dogs that we have with Arachnoid Diverticula, all these pockets of CSF that they get accumulated. Typically, you see that in packs. You see this in French bulldogs when they have some vertebral malformation, and within that maybe there is a little bit of instability or some type of a scar that happens into the dura. So the CSF start getting a little bit stuck there, and that CSF compress the spinal cord. And what do we do surgically to an arachnoid diverticula? What we do is we open the dura, we do a durectomy, or we do a marsupialization to let that CSF leak, which will be completely the opposite. In humans, what they do is CSF leak, and what they do is they close them, which I think that is a very interesting thing that we may also dig a little bit more in the future, because interesting enough, these dogs that they are more common to have arachnoid diverticula, they are brachycephalics, and they have also other spinal malformations. Typically, they have obviously the hemivertebra. They may also, some of them have some type of a spina bifida occulta. So definitely all this is really linked, and I think yeah, we are very passionate for all these CSF disorders, and hopefully we can keep seeing crazy cases.
Yeah, hopefully.
So, does anyone, so do you have, guys, any question about all these Kyary cases? Or I know that the Tether Cord and the occult Tether Cord. So let's also say again, remember the difference between the Tether Cord and the occult Tether Cord. So the Tether Cord is what we all have seen in the past, all these French Bulldog, English Bulldog with the spina bifida, the meningomyelocell. So they have that phylum terminally that is stuck most of the times to a meningomyelocell and is pulling up. So a lot of times what happens is that some surgeons, but the only thing that they do is that they remove that meningomyelocell that goes to the skin, but they don't release the phylum terminally. So you know that a lot of these cases, they have urinary and fecal incontinence. And there has been actually a recent paper talking about how many of these cases, they don't recover the fecal and urinary incontinence. And our theory, Abby and I, is that, well, I'm sure that a lot of other people, they have this theory. We are not like the gurus. But we do believe that these cases, they need to be detethered. They need to have the phylum terminale section, the phylum terminale internum section, so there is not that pull to the spine, and probably a lot of these cases, they will recover the fecal and urinary incontinence. So these are the easy to find, because you have spina bifida, you can even see on X-ray that doesn't look normal, and obviously on MRI, you will see the abnormalities. The difficult ones are the tether cord, occult tether cord, where you have the clinical presentations. The dog may be a little bit painful in the back, a little bit like weak, and he has this chronic urinary incontinence, UTIs, that you cannot find a reason for it. You do the MRI, you don't find anything. It seems that the conus is in the right position. How do we know that? We don't really know, because there is no, you know, all the humans, they finish the conus medullaris at the same level, which is L3.
Well, there's a little variability. We say we really don't want it to be below L2. Some people used to say between L2 and L3 was okay, but really, if you're getting below L2, worry. So the 3 criteria for classical tethered cord in humans on MRI is low-lying conus, so below L2, a fat signal in the phylum, and then a thickened phylum. So if it's greater than 2 millimeters is when you start worrying. Obviously, those things haven't really been validated in dogs, but you know, like with our Spinoni dog, we compared to a control dog of the same breed, at least for conus position.
Yeah, exactly. And there's been a recent paper by Natasha Olby that she's getting already interested on these Cavalier-King charts with Kyary, and where the conus medullaris is finishing. So we are very happy that not to be the only ones thinking about this. So obviously validates, I mean, again, this is happening in humans. We are not discovering anything that is not out there. We're just trying to rely this information and these procedures in our veterinary patients. Mm-hmm. So I would say that try to watch out for these cases for occult tether cord. these chronic incontinence that you cannot find why they are incontinent, and you don't find any other reason for it. And then the other kind of big part, which we have a lot of other things that we're not going to talk about myodural breaches, because then I think that everyone will like freak out if we start talking about also myodural breaches. But then we have the Chiari malformation, and we are very interested because we realize that also Cavalier clinicals would have a lot of Chiari malformation. They also have a lot of patellar luxations. They have also a lot of cardiomyopathies, which that is also another common finding for EDS people, right?
Right. Yeah, so mitral valve prolapse is very common across many of the subtypes of EDS. And so looking at the degree of mitral valve disease in Cavaliers, it's a little suspicious when you then combine that with Kyary and luxating patella.
So there was a question about if EDS is a genetic disease, and I guess also, is there a genetic test for humans and then for animals?
Yeah, so there's 14 known types of EDS in humans that we know of right now. There's genetic tests for 13 of the 14 types. The most common type of EDS, we don't know the genetic basis for at this time, hypermobile EDS, but hopefully in the near future, there'll be a genetic test for that as well. Genetic testing is available commercially for horses for 2 of the types of EDS that occurs in them. In other species, it's available on a research basis. It's not really available commercially.
But hopefully, there is a lot of people doing some research on EDS in animals.
Yeah, well, I wouldn't say a lot, but a handful, yeah.
Yeah, less than 5 people in the world doing
There's some.
The other question again, the clinical signs for so besides the incontinence into the presentation. So let's remember that, let's make a little bit the difference between the Kyary, Tether Core, occult Tether Core, and EDS, because although they may be all a little bit linked together, the clinical presentation is a little bit different. So tell us the typical presentation of the animal with EDS.
So for an animal with EDS, it would be severe skin fragility, possibly joint hypermobility. They could present just with like a catastrophic aneurysm, something like that. But typically you're going to see skin fragility first.
And we say that these are kind of the very, we don't know also how many degrees of EDS are in animals. So that's where we're thinking maybe we have some animals with some subclinical degree of EDS where they just like luxating patellas all the time and they have cardiovascular disease or GIs. But the typical EDS is the skin fragility.
Yeah, the large kind of gaping wounds that don't really bleed. There's one form in cats that causes sort of these necrotic, like Escher type wounds that don't really break open as much, but they also don't bleed.
Yeah. And then the clinical signs of the Kyary, guys, I will tell you this, typically is going to be chronic waxing and waning pain. So you have a dog that some days may be completely normal, some days they have the phantom scratching or just like a screaming pain. They don't know, they honestly don't know why, what happened, just suddenly they're going to be painful. And then you may also have dogs that they start being weak, particularly in the front legs when they are walking downstairs. They may give weight. So you need to ask the owner, is the dog giving a bit of weight when walking down? And then as it progresses, they may have severe proprioceptive deficit in all 4 limbs. What are going to be the typical signs, Abby, of the Tether Core, just the general Tether Core animals?
Well, in animals, it's harder to say, but incontinence, so fecal or urinary incontinence, weakness in the hind end. Well, fecal incontinence occurs in humans. It hasn't been described in animals, but I assume it could. So weakness in the hind end.
In dogs, because I mean it's a very typical fecal incontinence.
Well, probably with the like true spina bifidas, I guess it has, but with the occult tethered cord or the like fatty phylum tethered cord, I don't think it has. So back pain, leg pain, weakness in the hind end. Let's see what else. Kyphosis, scoliosis occur in humans. I guess it theoretically could occur in dogs with it. So the dermatologic signs occasionally occur in people. So like the sacral dimple or the odd birthmarks around the sacrum. I know that those have been described in dogs. The sacral dimples have been described in some of the spina bifida dogs.
Yeah. And then remember the occult tether core, you may not see anything other than just having the incontinence and some discomfort in the back or some kind of weakness in the back, but very, very mild signs. And then the other question about if there is any predisposed breed in cats with EDS.
Yeah, so Burmese cats are very predisposed. Himalayans are predisposed. There was some thought at one point that Siamese cats were predisposed, but I don't think a genetic basis was ever determined for Siamese. And then we definitely just see it in domestic short hairs.
Yeah. And so what, I mean, it's been describing, I know that it's been describing a lot of different breeds, sorry, not breeds, also very different animals. And there was like this story, I know that you always tell about the coats and the minks.
Oh, well, yeah, I guess back in, I think it was like the early 80s, I guess commercial mink industry apparently had a big problem with EDS where they were breeding them for fur coats and the coats started to fall apart because the skin was so fragile. So they realized that they had somehow accidentally bred EDS into their mink lines. So they were able to breed it back out and they haven't had a problem that I know of since. But I always thought that was an interesting story that they realized because the fur coats were falling apart.
Buying fur coats just fall down.
Yeah.
So another question about the hydrocephalus being associated. So yeah, definitely. I mean, hydrocephalus, it is part of some type of the Chiari malformation in humans, not all. And then you know that our Cavalier King Charles, some of them, they may also have some type of hydrocephalus. What is your experience with that, Abby?
We don't see it so much with EDS in general. What we see is more, like I said, spontaneous CSF leaks, and then idiopathic intracranial hypertension is very common in EDS, but not really true hydrocephalus.
Yeah, we see a lot of, I mean, obviously Cavalier King Charles, they are also brachycephalic dogs, so they're going to have an enlarged ventricular system. We don't tend to see hypertensive hydrocephalus, and hydrocephalus definitely, it is also another subject that I'm very interested because at the end of the day, it's all related to CSF, and I'm also very interested on this difference between the non-hypertensive and the hypertensive hydrocephalus. But it's true that we have not concentrated our research on that for the time being, but definitely, yeah, it's something that interests me a lot. And actually, I was speaking yesterday with a colleague from Glasgow that they are doing some research on non-invasive intracranial pressure measure, and I was saying that, yeah, obviously something that we are very interested in. And we need to be linking all together because definitely the ventricular system is related to the central canal and to the subarachnoid space, and it's all a communicated system, like the ligaments that hold the spinal cord, but obviously the CSF is leading everything around.
Yeah.
So you think that Reed is gonna come and perform? Is he gonna show us his belly? No.
Oh, I mean, he can. What do you want to see?
So Reed is always poor thing wearing t-shirts because, yeah, tell us what he does if he doesn't wear a t-shirt.
Well, it prevents him from over grooming. So a lot of animals and people with EDS are theorized to have some degree of mast cell activation syndrome. So basically their mast cells are always on high alert, so it makes you very itchy. Reed takes amitriptyline because it's a very potent histamine blocker, and it also helps with pain. But his shirt protects him just from bumps and scrapes, and then also from his overgrooming. So he's very used to wearing his clothes, and it doesn't really bother him. Yeah. What do you want to see him do here?
No.
I can take his shirt off and stretch his skin. Here. don't know if we can really.
Can you see, guys, that is amazing, huh? So there is quite a few of these cats on Instagram, and they have this kind of cute, sad face, as Abby was saying, because they have so much skin in the cheeks. And Reed is over 1 year old already.
Yeah,
what is usually the lifespan of these cats?
We don't really know. The oldest one that I know of lived to be 13. And then I also know of one who died at 11 months from a aneurysm. So it's very variable. I mean, there's multiple genetic mutations that occur in cats. So some of it depends on that, but some of it's also just, you know, a toss up. He's been evaluated by cardiology and they think he looks pretty good right now, but he does get a lot of wounds, so.
Yeah. And there was another question about if the permanent fur loss is a common symptom of EDS in animals.
It's not. I know of a couple cats that have it. I don't really know what to attribute it to in all of them. In Reed's case, he had very severe wounds over his neck and dorsum as a kitten. I think part of it was from playing with a sibling and part of it may have been from his mother. So I think some of it in his case is that he has so much scar tissue that it's not going to grow back.
Yeah, yeah. But yeah, I think that because there was also this cat, the poor glass, yeah, but I think that he had all this hair problem because of it. He had other skin issues not related to EDS.
Oh, for the hair loss? Yeah, I'm not sure what that was from. It may have been secondary to wounds that had healed because they do get a lot of scar tissue. One thing I do recommend, like I'm very anti-declaw in general, but I do think in the more moderate to severe cases in these guys that declawing in the hind end is really necessary if you're going to try to keep them.
They get stuck all the time in the skin.
Yeah, yeah. Because every time they scratch, it's just catastrophic wounds. Some of them do okay with nail caps, and if it's a cat that's very tolerant of that, then that's definitely a conversation that you can have, but I think most of them declawing is really the only option.
How many times have you gone to the ER to close wounds in? So now he's, what is like 15 months, something like that?
He's like 20 months.
20 months. But you have him when he was, what, like 5 months, something like that?
I think he was like 8 months when I got him.
8 months. Okay.
I closed most of his wounds at home with skin glue, but he's been to Tufts or the hospital where I work nights 6 or 7 times maybe.
So I think that is probably, I mean, I wouldn't say every week, but every 2 weeks, there is some type of wound that you need to do something about.
Yeah.
So that is how fragile is the skin. But for example, your skin is super stretchable also. Should we do a comparison?
Well, mine's not as stretchy as his, but it's...
That's not that bad.
I mean...
And then I need to do the test of the...
But okay. I'm more hypermobile.
Yeah, you see how she can do it? You all need to do it to see if you have EDS. But for example, the skin fragility, is that common in humans with EDS?
Well, it depends on the type of EDS. So the more common type of EDS in animals is called dermatosparaxis EDS. So that's only been described about 10 times in humans. And it's pretty catastrophic in humans in terms of brain damage from intrauterine brain bleeds. They have horrible skin fragility, aneurysms, all those things, but it's very uncommon in humans. But the more common form in humans that causes the really stretchy, like elastic man skin is called classical EDS. So that occurs about 1 in 100,000 people. So, okay. I mean, yeah. It's fairly uncommon.
And I guess that also the joint mobility in a cat, I mean, it will be difficult to see, right? Because they are so flexible anyway.
Yeah, and we commonly see it in dogs, and that's when you get dogs that are like really collapsed down in the carpal joints and have trouble walking. And it's typically pretty extreme when I've seen it to the point where it's impairing their way of life and their mobility. But there may be a lot of animals that have a mild degree of joint hypermobility that we just don't really pick up on.
Oh, I think that is a good point, and we haven't talked about that, but it's true that, if you remember, guys, sometimes we have these puppies that they have severe carpal extension, hyperextension, and they really work on the carpus. Remember that is not neurological, okay? You can have a very low tarsus because of a polyneuropathy, but you're not gonna have a low carpus. The low carpus has to be mechanical, and particularly if you have a puppy, then you will need to be thinking about having some type of connective tissue disorder. So
well,
then
that's a
hypermobility in the carpus, and ask about incontinence, ask.
Right. But that's another point, is the puppy thing. So I get messages from a lot of vets and a lot of owners about animals that are older where they've suddenly developed some degree of something. EDS occurs when you're born. It's a genetic disease, so you should have symptoms of it your whole life. It may get a little bit worse as you get older, but you don't suddenly develop it. So we also need to keep in mind that if you have an older animal that's suddenly developing skin fragility or orthopedic symptoms, it's probably not EDS. It's probably feline skin fragility syndrome or something else.
So we had a very interesting question. So probably someone that has been reading some of our not papers that we write. The dynamic MRI useful for diagnosis of Tether Core in dogs. There hasn't been anything published about dynamic MRI in Tether Core in dogs. They are just starting to publish more data about dynamic MRI, particularly in wobblers disease. And there is particularly Dr. Da Costa from, well, he's originally from Brazil, but works in the United States. And the problem also about the dynamic MRIs is also you need to be thinking how much weight you need to use to do a dynamic MRI. And we don't have also standing MRIs like you do in humans. For example, Abby is going to go and have a standing MRI. Okay, she's had an MRI. So I think that it will be very interesting, but I don't know logistically, there is still quite a bit that we will need to be working for doing dynamic MRIs on the LS area. It's going to be a little bit difficult to do, I think.
Yeah, so the standing flexion extension MRIs are really becoming the standard of care in EDS patients, especially with Kyary and craniocervical instability, just because with EDS, when you add the effect of gravity to the situation, you tend to see a severe exacerbation, both in the level that the cerebellar tonsils are sitting at and the degree of instability in the spine, just because the ligaments are already weak. And then when you add the effect of the patient standing and having the force of gravity on them, things tend to get dramatically worse. With tethered cord, it can be kind of hit or miss in terms of whether it's worse with the flexion extension MRI or whether you can then see the occult tethered cord. Occasionally in flexion extension, you can see like some degree of bowing of the spine, which can suggest that the cord is under tension, but it's definitely not a slam dunk in terms of diagnosis.
Okay, I was just checking if we had any other questions around there. So I thank you very much, guys, for asking all these questions, because I know that this was not going to be an easy talk for asking questions, because we were going to share our weirdness, our more obscure ideas, and yeah, if we're gonna keep posting things. Reed is gonna keep having his Instagram page, trying to let everyone know about EDS in humans and in animals. And then Abby's gonna continue to do all of her research that she's doing now. So what are you working right now? Can you talk about, or is it a top secret?
I'm working on a couple tethered cord papers, and I'm working on a paper on the myodural bridge, which we didn't talk about, but we can talk about that another time. You should all screen yourself with the Beighton score. So the Beighton score is how we score hypermobility in people. So it's a test you all can do at home. So you get a point for each thumb if you can touch your thumb to your forearm. You get a point for each pinky if you can go back more than 90 degrees. You get a point for each elbow if your elbows hyperextend. You get a point for each knee if you stand straight, if your knees hyperextend. And you get a point if you can stand and bend at the waist and put your hands flat on the floor. So if you're 5 or greater and you're an adult, you should be thinking about connective tissue disorders.
Exactly, and that's also, this is very obscure. And let's say also one last thing. How many bones did you break before you were diagnosed with EDS?
I've broken 18 bones now. I'm not sure what it was then, probably 15 or 16 before I was diagnosed.
So that's a lot of bones. And how old were you when you were diagnosed with EDS?
I was diagnosed when I was 19. Our family has a rare form that causes a progressive lung disease, and it causes bone fragility, obviously. So it's more of an overlap with osteogenesis imperfecta. But I was the one to suggest that I had EDS because the doctors just weren't very familiar with it.
Exactly, and that's also what we want to talk about this, because of course we want to share the awareness about the animals. I think that we are missing a lot, but in humans still there is so many people that they still misdiagnosed with EDS. And again, Abby was the one that suggested to her doctor, but you have had so many people also coming to you thinking, I think that I have EDS, because of just like talking about it. And there is also some like very sad stories of kids being taken away from their parents because they have inexplicable fractures, and it's because they are usually it's because you are over flexible, right? Or well, in your case you have some fragility, but there is also because of the
sure, I mean, unexplained dislocations and fractures and things have definitely led to some child abuse claims. I think, you know, if I had been growing up today, it probably would have been a little bit of a different scenario in terms of questions being raised with non-traumatic fractures. But yeah, it's very scary.
But you still are an avid horse rider, so.
Oh yeah. Well, that might say something about my IQ, but yeah. No, I mean, you know, I think that's the thing about having a chronic illness or having any challenge in life. You just have to keep doing what you love doing.
Yeah, and I think that that's also like a very important message that yeah, you just like didn't decide to just sit down and moan about what was going on. You just like you have the passion because you really want to see some advance, and because you have the passion, you're just doing what you do best because it's something that you like and you believe. And congratulations for that.
Yeah, thank you. Yeah, thank you. Send us lots of cases.
Okay, yeah. So thank you guys. Hopefully that you all enjoy your hypermobility scores that you are all doing right now. Hope that no one is finding out that they may need to check with their doctors. And just keep looking for these cases. Okay. Have a good weekend to everyone. And I'm gonna try, I have recorded the video. Let's see if it works. And if it works, I will put it on YouTube. Hopefully there was, yeah, we could have it recorded. Have fun. Thank you for being there. Bye. Bye.
Bye.
For being there.